Lots of people ask me about the lumps and bumps underneath their eyes that most people call bags. Some people call them, malar edema. Some people say festoons, and they really, that terminology is very confusing. So I want to clarify that for you. There are fatty cushions in the upper lid and the lower lid that protect the eye. And so when the connective tissue thins as we all get a little older, the fatty cushion comes forward, and that's what gives you the bags. And that's the fatty cushion that we remove some and replace it for volume. The other lump and bump you get is malar edema. The malar region is the cheek. That's the term. So when you get localized swelling over the cheekbone, it's called malar edema. A festoon is something that is more genetic, and it's when the combination of the skin and muscle thins and you have spreading of the muscle and separation from the skin, and you get a larger kind of a water balloon effect. And that's very technical. You have to be an expert to treat and surgically repair a festoon, because you have to do it at the skin layer, the muscle layer, and even deeper around the bone layer. So if you have a festoon, which is that area that's lower that just kind of won't go away, make sure you see an expert for that, because most people don't even understand what it is or know how to repair it.